May is Mental Health Awareness Month, a topic that people may be much more attuned to after the last 14 months especially. During this month, we're trying to highlight ways to manage mental health issues as part of our series, You Are Not Alone. Last summer, when the pandemic was just a few months old, I did a couple of stories about how the time at home was affecting people with addiction. After those stories, a Kansas woman who works specifically with women addicted to pornography reached out because her client load had grown after the pandemic started. So this week I wanted to check back in with her to see how that client list has changed over the course of a year.
My client load has continued to grow. At the time when we last spoke, I had I think it was one virtual recovery group at that time, and now I have 5. And also had to bring on a second clinician to my practice to help me with some of that client load that was coming on. And I'm actually in the process of hiring a third clinician because we just continue to get, consultation requests and women coming to us asking for help, and we want to be able to serve them when they come.
So during our conversation, Day compared sex and porn addictions to other addictions, both in terms of how your brain reacts to them and the cost of maintaining them.
Porn is the easy choice because it's available and it feeds that same pleasure center of the brain that alcohol and drugs do. And so if you're talking about what can I afford, especially during a pandemic when you don't have maybe the income you once did, pornography is available and it's a companion. It's there for you all the time and it's there for you for free.
So if you're struggling with addiction, Day is accepting new clients right now. Her website is livingonpurposekc.com, and she just launched a new podcast called She Recovery Podcast with experts in this field on her that episode's as guests. We have a link to both of those right now on our website, kshb.com.